Welcome back to Angel Winnie Instant Tutorial. In this video, we are going to study about the bed bath. So, I hope you guys knows about the bed bath. So, that is a procedure. It's a very important procedure we will be studying for the nursing life. So, nursing students, they must know the bed bath. How to give the bed bath is very, very important. So, don't forget, it's very, very important procedure you have to study. Okay. So here, look at this one. So what is bed bath and sponge bath? So we can say the bed bath or else we can say the sponge bath. So if the question is asking what is sponge bath, don't forget to answer. So that is the bed bath. Okay. So what is it? So what is the bed bath? Have you heard about that? Yeah. What is that? So bed bath is cleanses the skin and helps keep the skin free of infection. It helps to relax the person, being bathed and help him for better. And let the person wash himself as much as possible, or you may need to get the bath place ready and wash the person's back, and you may need to do most and all of the bath. So, what is that? It is nothing but it cleanses the skin. So, it cleanses means it will be clean the skin, helps keep the skin free from infection. So, to help the skin free from infection, so we will clean in the skin. Along with that, it helps to relax the person being bathed. Yeah, obviously. So, the sorry, that body muscles, no, it should be relax and help him for the feel better. If the person can wash or the patient can bath himself, he will take her and we should assess them, giving water, all the things as a nurse we should assess, or else we have to give the person, bed bath. And here we have to more concentration give to the where the person backside. Why? Because the person or the patient have the more chance to get the what bed sore. Okay, have you heard about the bed sore? So that will be mainly occur in the back of the patient. So we have to give more care to the person's back. Okay. So here, what are the things before a bed bath? What are the things we should be understand? We should know. So simply whether we can give the bed bath, it's not. So simply we couldn't, without knowing the procedure, without seeing how they given the bed bath, how can we give the bed bath? It's not possible. So we should know some of the point. We should remember that. So first one is to explain what you are about to do if even if the patient is unconscious. Okay, so first of all, we should tell the patient. So we are, hi sir, how are you? So we should greet them, right? When you're going, suddenly you will go and keep the basin there, whatever you will keep arranged, and you will and start to give the bed bath. What they will think that, oh my God, what is the nurse is doing to me? Is going to kill me? She's going to kill me, or what is doing? So they will feel scared. Especially, so if they're in the hospital, obviously you guys will be get scared. So first, you have to explain. You have to when you are entering, you should knock it. So anybody will be there, they will open, and you should, well, the manner should be, you should maintain. You should go inside and you have to tell the patient we are going to do a bed bath. Okay. Then, if the patient is unconscious, means no need to do all the things. Okay. So, unconscious means that they are not knowing. So, conscious means conscious and bedridden patient means we should say all the things and clear the area of any obstacles so that you can move around freely. Okay, so you have to clear that area near to the bed. If there any table or anything it is there, means that all the objectives or the objects you have to clear, then only you can move around the patient and ensure the what is warm, what should be warm, and there is no this one fan, AC, nothing. So if you're giving the bed bath already, water is there, patient will be feel too much of what cooling. Next one, have all equipments to hand so that you do not have to leave the patient during the procedure. The very important thing. So you should keep everything before starting the procedure. In between, you are pouring water and you, oh, where is that soap? Or where is that this? So I forgot you are going and taking. That is very wrong. So you should keep all the things near to the patient. Then you have to start the procedure. The use of toiletries such as deodorant and cosmetics and perfume should be determined by the patient. Patient side, they have to keep all the things if there are any this talcum powder, whatever it is, there whatever perfumes or body lotions if they are having, so that the patient side has to be keep. Okay. So next one is a purpose. Why we are giving the bed bath to the patient? Is there any purpose? Yes, obviously there is a purpose. This bathing is an important part of the personal hygiene, right? So everyone should bath daily, right? You guys is everyone you will bath, I know. So here patient also should bath. Otherwise, why? What is that? That's the personal hygiene. We will get bad odor. And the bathing cleanses the skin and make the patients more comfortable. Yes, and it will be clean and make the patient will be feel freshness, and it stimulate the circulation and relax the patient. And so, as I said, no, to the muscle, the nurse will give the massage which will be improve the circulation and relax the patient. It is a good opportunity to serve the patient, observe the client body as well as communicate with the patient. So there is a opportunity to serve the observe the client and to communicate properly. So that is the purpose of bed bath. And next one is the indications. What do you mean by indication? To whom we will give, to whom we will give bed bath. Okay, to whom we will give the bed bath. So that is indication. To whom we will give, whatever. Okay, so that is indications. First one is a bedridden patient. Bedridden patient means what? The patient is lying on the bed for a longer years. Okay, it may be more than 6 years, 1 years and all. So that for those patients we will give the this one bed bath. Coma patient, they are not conscious, unconscious. We can say that is unconscious patient. And major surgery. So what are the major surgery? Maybe head injury. Okay, head injury. All those things we will give. Major surgeries, orthopedic patient with the surgery. So orthopedic patient means they are not able to walk. This is a fracture patient. Orthopedic means maybe any bone fracture. Then mentally ill patient. So that means a psychiatric. Psychiatric patients we are not giving. Sorry, we are giving the bed bath and certain some of the infections they will be bedridden. Patient with amputation. What do you mean by amputation? Have you ever heard about that amputation? So, it's a removal of body parts, upper and lower body parts, upper and lower body part. What do you mean it? Okay, that is the hands or legs. So that all the things we can say. So what are the things is bedridden patient, coma patient, major surgery, orthopedic patient surgery, mentally ill patient, certain infection patient with the amputations. Okay, so let's move to the procedure. Yeah, we come to the procedure. Performing the bed bath. So what are the things we will keep it in mind? So first one is the definition. Here definition is a bath is given to patient who is in the bed and unable to bath itself. So person is not able to take bath or patient in the bed, we will give the bath. So that is called a bed bath. A bath given to the patient who is in the bed. Okay, what are the purpose? Again, they are asking to prevent the bacteria spreading on skin. So there is a lot of bacteria will be there. The skin, we have to prevent it. And to clean the client's body. And we are cleaning the client body and to stimulate the circulation, to improve the general muscular tone and joint. So as I said, the muscles. muscular tone and joint to make the client comfort and help to induce sleep. Yeah, after bath they will feel sleep, observe skin condition and objective symptom. Is there any disease, skin infections is there? These are the things we can identify by seeing that. This is the purpose. And what are the equipments? Okay, so we should arrange the equipment before starting the procedure. Basin for without soap and with soap one. Bucket for clean hot water one. For wastewater one. Jug one. Soap with the soap dish. Sponge bath cloth for wash with the soap for rinse. And face towel one. Bath towel two for covering our Macintosh one. For covering our client's body one. Then ghost is 2 to 3. Macintosh, I hope you guys know what is a Macintosh. You have seen in the hospital. There is a rubber something like it is there. Not rubber, it's a plastic something. It is like two colors will be there. And trolley, thermometer. Thermometer, what is a earth water thermometer? Okay, temperature thermometer. And old newspaper, paper bag with for clean goods and for waste. Okay, so these all are the equipments so we kept ready and we are going to give the bed bath to the patient. Okay, so procedure complete bed bath we are giving. Mm, okay, so first one, before giving the bed bath, we should confirm the doctor's order. Yeah, whether doctor's is written or not. Check the client identification and condition. Why we are reading the doctor's order? Whether patient is correct or not, simply we are giving or not. Okay. And so that is the thing we should identify why we are giving. So that is the action. That is an action alert. Action alert why we are giving. The bath order may be changed, maybe why we are again checking means is the order changed or not. In some instances, bed bath may be harmful for the client who is in pain, hemorrhage, or weak, or illness need to be referred to the bath. Some case the this will be bath will be cancelled. Again, we will check once again. And next action is explain the purpose and procedure to the patient. We will say the purpose and procedure to the patient. If he or she is alert and oriented, if they're unconscious, question to the patient about the personal hygiene, preference, ability to assist with the patient. And if the patient is able to bath, and we will assist the nurse will assist the patient, or else we'll give the bed bath. And here, what is the rationale? Providing information foster cooperation. Why we are explaining the procedure to the patient? We should know what we are going to do and encourage the client to assist with the care and promote the independence. So they should have the independence simply without saying that if you're going and giving bad things, they won't allow. We should ask if they're conscious. Then nursing care, sorry, care action means gather all required equipment. As I said, no, you have to gather all the requirement near to the patient, organization and facilities accurate the skill performance. So then only you can take all the things. So you will check it whether all the thing that is there or not. Wash your hands and put on the gloves. So what this one for the this one bed bath which type of or what type of hand wash you will prefer? So medical. Okay, so there is a two type of hand wash will be there. What are the hand wash? That is the medical hand wash and one more is the surgical hand wash. Okay. Well, medical hand wash means what? Okay, so there's a hint. Is there any easy hint for medical hand wash? Yes. Medical hand wash means from the elbow to arms, elbow to palms. So elbow to palms, we will rinse the hand. So that is called the medical, and the surgical means a palm to elbow. The way we will be cleaning. So that is the what here surgical. Okay, here means elbow to arm. Sorry, palm. Here palm to elbow. That means we will rinse hand. Okay. So that is the this one. And what is that? To prevent the spread of organism, gloves are what is that? That must be wear if they are giving the perineal and anal care. Yeah, why we are giving the this one perineal care? this is the perineal area. If you want to clean means this glove should be needed. And bring all the equipments to the bedside. Yes, we organize all the things and close the curtain and door. Yeah, obviously we should provide the privacy and the room should be warm. Maintain the client privacy and put the screen and curtain. Yes, privacy and prepare for hot water, 60 degree. So if the patient is need that according to the this one, we will give the hot water during the cool procedure. Remove the client cloth, cover the patient body with the top sheet and a blanket. We are covering the body of the patient. Which part of the body is bathing, that only should exposed. And if IV set is present on the patient upper extremity, thread the IV tubing and back through the sleeves of the soiled cloth and rehang the IV solution. Check the IV flow rate. Okay, if it is there means for a while we can be stop it and keep it there. Then removing the cloth and permit the easier access when the washing clients upper body and be sure the IV delivery is uninterrupted and that we maintain the sterility of the setup. Why? Because we are uninterrupted means otherwise is this one soap, all the things will be mixed with that. So it's the baby and sterility. So that we are keeping away all the things. Next one, fill two basin about two-thirds full with warm water that is 43 to 46 degrees Celsius and 110 to 115 Fahrenheit. Here why we are maintaining that temperature means here water at proper temperature relax him and her so where the warm and water will be cool during the procedure. So there is a hot water is needed. Then next one is assist the client to move forward side to the bed where you will be working. Usually you will do must work with your dominant hand. Dominant hand mean mainly. So what is our dominant hand? Right hand. We are moving the patient and keep the client near to you, reaching across the bed. So that's what. First we were giving where the first we will give the more importance means first we will give on the face. Okay, face. Put Macintosh and big towel under the client's body from the head to the shoulder. From the head to the back of the head, we will spread over the Macintosh and the towel. Place the face towel under the chin and which is also covered the top of the sheet. And to prevent the bottom sheet from macking wet. So to avoid the wetting, we will keep the Macintosh and first the Macintosh. Over the Macintosh, we will spread the big towel. Then make mitten. Mitten means that wiping the cloth. Make the mitt with a sponge towel, moisten the with the plain water, moisten and why we are soap irritate the eye. So face we will be moist at the mitten and the sponge we will keep it this one wiping over the face. Wash the first client eyes and cleanse from inner canthus to outer corner and use a different section of the mid to wash the eye. From the inner eye to outer eye, we are cleaning first eye. Then washing from the inner to outer corner prevents the sweeping debris in the client's eye, using separate portion of the mitten for each eye to prevent the spread of infection. Then wash the client's face, neck, ear with the soap of this area only need client prefer rinse dry carefully. This area where that face, neck and ears we will use the soap sponge to clean that here. What is that? Here very carefully we have to do. Soap is particularly dry into the face and we should dry it. The next one is the upper extremities. So first we were concentrating on the face and neck. Next one is the upper extremities. Upper extremities means move the Macintosh and big towel under the patient forearm. Okay. So uncover the forearm and fold the sponge bath and moisten. Wash the fur with the soap and rinse. Use long socks, wrist to elbow to the shoulder, axilla hand. Where and wrist, first wrist we will be, then elbow to shoulder, last is the axilla. Why we are giving the chance to the axilla? Axilla means more infection will be there because it's a what? Because it's more infected area. Why? It's a more wet area. There is a more wet area, so more infection. So that's why we are giving last chance to the axilla. And why we are giving? Washing the far side first, prevent the dripping bad water on the clean area. Long stroke improve the circulation to facilitate the venous return. And dry by the face towel. So we will wet it and we use the soap and dry it. Move the Macintosh big towel under the near arm and cover it. Wash, rinse, dry the near arm, same as the procedure. So first face, next one upper extremity, next where we were going. So next is chest and abdomen. Third part is chest and abdomen. Okay. Chest and abdomen. Move the Macintosh towel under the tongue. There is a back side. Put another bath towel, cover the chest. So, in case of female patient, mainly we will cover the chest part. And fold the sponge bath and moisten. Wash the breast with the soap, rinse and dry by the big towel covering. Move the bath towel covering with the chest to the abdomen and fold the sponge and moisten and wash abdomen with the soap, rinse and dry. Cover the trunk with the top sheet and remove the bath towel from the abdomen. So why? Macintosh and bath towel to prevent the sheet from wetting and the bath towel and provide warmth and privacy. That's why we are covering. The next one is the exchange the warm water. Then after this procedure, we will exchange the warm water. Why? Because already that is cool bath water is uncomfortable. So the water is probably unclean. So we used for the face, chest, and the upper extremity. So we will change the water. The last one is the lower extremity. Lower extremity, move the Macintosh and towel under the foreleg and put pillow and cushion under the bending knee. Knee should be bent and there keep the pillow all the thing near leg with the bath towel. Fold the sponge and cloth moisten and wash with the soap and rinse dry. Direction was from the first foot joint knee from knee to the hip. So this is the area because the groin area more that that's right. Repeat the same procedure on near side. Cover the lower extremity with the top sheet. Remove the cushion and Macintosh and the big towel. Then why we are giving that this one pillow for the this one for the support and for the lower extremity and make the client's comfort and turn the client on the left lateral position with the back towards you to provide clear visualization, easier contact to the back and buttocks. Turn. So we will give the lateral position. So here one of the position. So first the patient will be supine position. So we are giving the bath in a supine position. So next for seeing that this one what? Buttocks we giving the lateral position. Okay, that is enough. No need to give the prone position. That is better lateral position to see the back. And next one, we are going to the, so we have seen the third is chest and abdomen. Last one is the, that is the third and fourth. We are moving to the back and buttocks. Okay, back, move the Macintosh and the big towel under the trunk and cover the back with a big towel. Fold the towel and moisten. Uncover the back and wash with the soap and rinse dry with the big towel. Back rub is needed. Yeah, that back side we need to give the rub. This one back of the this one cervical to lumbar area, no? So we need to give the this one rub. And so see your nursing man back hair, it is there. So next I will take the back hair. Remove the Macintosh and big towel. So then here, why we are giving the skin breakdown usually occur. Cover the bony prominence carefully. Observe the sacral area back for any indication. So there is a skin infection or that is there any bedridden patient having the bony prominence problem will be there. So we need to give the massages. And last one, return the client to the supine position. Again, we are coming to the patient in the supine, then make comfortable. And giving that last one is the fifth one, giving the what? Perineal care, care giving to the perineal area. See our nursing manual. So there is a perineal care. Is that the very important perineal care? Back care also very important and perineal care also very important. So I will take later. And clean the perineal area to prevent the skin irritation, breakdown, and decrease the potential odor. Then assist the client to wear a clean cloth and provide the warmth and comfort. After bed bath, make the bed tidy and keep the client in a comfortable position. Check IV flow, maintain it with spread prescribed speed prescribed to. If the patient client is given IV to confirm IV system is going properly. Document on the chart with your signature and report if there are any findings to the senior staff. Documentary provide the coordination of care, giving signature, maintain the professional accountability. So this is about the procedure of bed bath. I hope you guys understand the bed bath. So mainly we are giving concentration on the face, upper extremities, then chest and abdomen, then back and perineal care. Perineal care already, this one it is a separate care, so I will take later. Back care also. So this is about the bed bath. I hope you guys understand. If you have any doubt, you can comment below the discussion box. I will be continue with the another procedure. Thank you all.